Hi and welcome to Fertile Minds. I'm Dr. Sonal Karia, a fertility specialist associated with IVF Australia. Today I'm here to talk about fertility preservation for people who are facing cancer treatment. It's obviously a subject that's very overwhelming, but can also be equally empowering with the information that you get. Cancer patients do need to consider fertility preservation, and I obviously mean it for both men and women. I am using the word men and women only in the biologic sense here. Women are born with all the eggs that they're ever going to have, and they have a very finite reproductive lifespan. Cancer treatments may involve doing surgery, which sometimes may involve removing some of their reproductive organs and losing their fertility in that sense. Or it might involve toxic therapy like chemotherapy or radiotherapy, which can affect their egg count and egg reserve. And because they have a finite number of eggs, losing those eggs and not being able to replace them biologically would affect their future fertility. So most cancer specialists and medical specialists who advise these therapies are very mindful of referring people to fertility specialists so that they can have a conversation about trying to preserve their fertility in future. Equally, men who have cancers in younger age can lose their fertility because of toxic chemotherapy and radiotherapy, and they might equally think about preserving their fertility in future with some sperm freezing or other processes. And that's where the importance of fertility preservation lies for people who have cancer in the younger age. For women, there are a few options that are available depending on their circumstances. So for the pediatric and the young adolescent population, the only option sometimes that is available is to preserve a part of the ovarian tissue. This can be done fairly easily by doing a simple keyhole surgery, which is a laparoscopic surgery, getting a part of the ovary out and trying to freeze that tissue so that it can be used in the future for reimplantation into their ovary and hopefully get some eggs out of the reimplanted tissue. Women who are a bit older can also think of preserving their fertility by freezing their eggs or by creating embryos from those eggs. This would require going through an IVF cycle. And again, IVF cycles in most circumstances are very straightforward with very low complication rates. Another option that may be available is to freeze ovarian tissue in women who are not fit to go through IVF processes or who don't have enough time to go through the IVF process. And in some circumstances, we might advise some medications which might create a temporary state of menopause for a while, and that might help in preserving their fertility. So there are lots of options available depending on the circumstances that we find ourselves in. For men, hopefully the process is going to be simpler because they can ejaculate and give us a sperm sample. And sperm freezing is something that has been done for decades and is very, very realistic and very simple to do. So men can preserve their fertility by giving a sperm sample, which can be frozen at one of the IVF labs for future use. The duration actually depends on the type of treatment that we have decided to go ahead with. If it is somebody who needs to have ovarian tissue frozen and needs a surgery for that, it can literally be planned within a couple of days after they have seen us for a consultation. It's a small keyhole surgery. The recovery is usually very quick and straightforward if everything goes as per our plan and if there are no complications. Of course, if it's an IVF procedure that we are talking about to freeze eggs or embryos, a typical IVF cycle can take up to about 2 weeks. And if we have that much time, it's a very successful procedure that we can do within about 2 weeks. For men, it's a matter of coming to our clinic, giving a sperm sample through ejaculation, and that sperm sample can be processed and frozen on the same day. In terms of the success rate, again, it depends on the procedure that was carried out. It also partly depends on the age of the person at the time the fertility preservation procedure was carried out. We do know that egg quality does deteriorate after the mid-30s. So the success rate after the mid-30s would be a bit lower compared to somebody who has managed to freeze their eggs or embryos at an earlier age. The sweet spot probably for egg freezing is somewhere in the early to the mid-30s, but as far as cancer is concerned, unfortunately, it can happen at any time in a person's life. and we would just have to manage treatment at that time. In terms of sperm freezing, success rates are very, very good. We do lose a little bit of the material when we thaw the material, but in general, sperm freezing has been done for decades and has been very successful. So I would say for sperm freezing, egg freezing, and embryo freezing, we have excellent success rates. For ovarian tissue freezing, probably a bit lesser at this stage, but the science and technology are progressing, and I'm sure we'll have better success rates in the years to come. And for injections or medications that we use for fertility preservation, it really depends on the age of the person, the egg reserve at that time, and the duration of therapy and type of cancer that we are talking about. Thanks for watching. Don't forget to subscribe for more fertility insights and expert advice.